Hey you guys, welcome back to another Miseducated Rambler video. My name is Bulani Dube, but YouTube prefers to call me Miseducated Rambler. So welcome. Okay, so today is part 3 of the fibroids series. We are talking pregnancy, how fibroids affect pregnancy or infertility, and whether you can get pregnant if you have fibroids. So let's first start by defining what infertility means. Okay, so according to WHO, infertility generally means not becoming pregnant after 12 months of regular, unprotected sexual intercourse. So if you're unable to conceive after 12 or more months. And then fibroids may be the sole cause of the infertility in 2 to 3% of women. So it's not always the case that fibroids are the reason for the infertility. Fibroids would be the reason in 2 to 3% of all women. The development of pregnancy is multifaceted, it's multi-layered, right? So it can be influenced by a variety of factors, like, for instance, maternal age. As women, when you reach a certain age, it can become very difficult for you to conceive, right? Another thing would be the sperm or the egg quality. If they're poor, then there would be a problem with conceiving. Another factor could be the uterine, right? The uterine lining and its ability to receive an embryo. If it's poor, if the receptivity of the uterine is poor, then it would be difficult for the embryo to implant itself onto the uterine lining, right? And then there are gynecological conditions that could affect implantation rates, like endometriosis, uterine fibroids, like we're discussing today. There are like endometrial polyps as well that can influence. And then you also have lifestyle habits that we engage in, like if you drink alcohol, if you do drugs, if you smoke, and right? So all of these things can affect the success of reproduction. So let's talk about the role that fibroids have when it comes to infertility. So by now, we already know that there are different types of fibroids, right? So with the subserosal fibroids, it's been proven that they don't seem to affect fertility because they don't have an impact on implantation. When it comes to abortion, they don't really have an impact on that. Preterm births, and. In contrast to the submucosal and the intramural fibroids, which are the ones that would distort the endometrial cavity, right? These ones are associated with low pregnancy rates, implantation rates, and delivery rates. So let's get into how exactly these two would affect fertility. Okay, so how exactly do these fibroids cause infertility, right? So, for one, the changes that can occur in the shape of the cervix can affect the number of sperm that is able to pass through to go and fertilize an egg, right? The fighters that are able to can squeeze through and go look for an egg. However, there's a chance that they might not even find an egg because remember that some fibroids can also block the fallopian tubes, which are the passageway for the egg, right, to come down and get fertilized. So conception could be hindered in that case. And then we've talked about blood flow being reduced, right? So when some fibroids grow and become large, they can change or affect the blood supply of the uterine lining, which is required for an embryo to implant itself onto the lining. So if there isn't that blood supply, an embryo can end up just dying and not being able to implant, right? Am I supposed to say that? Can become unalived. And then larger sized fibroids can change or affect the size of the uterus. And yeah, we will get more into how that would be a problem when we're now talking pregnancy and how fibroids affect pregnancy or can cause pregnancy complications. Before we go any further, just to bring you a shimmer of light, a glimpse of hope, I guess, it is very possible for you to get pregnant with fibroids, and it's also possible for you to go through the pregnancy without any complications. Okay, and this is usually the case when the fibroid is small and it is not it's located outside the uterine cavity, the uterine, right? And also it's possible if you are a believer in Christ, if you pray and you believe in miracles, so you can definitely have a good safe pregnancy in those cases. Okay, so let's talk about the complications associated with fibroids and pregnancy, right? So, first of all, during pregnancy, it's possible for the fibroids to increase in size. And this is because of the increased blood flow, blood supply that goes to the uterine wall to help in the development of the embryo, right? As well as an increase in the hormones. Remember that fibroids are hormone dependent, so they would in some cases increase in size because of that. Um, However, it's been shown that after delivery, these fibers can end up shrinking in size after giving birth, and they actually increase in size usually during the first trimester of the pregnancy. That's when there's like that substantial increase in size. Yeah. So the biggest or the major concern that we have with fibroids in pregnancy is that they tend to increase the chances of preterm births, um, or miscarriages. Miscarriage is when you lose your pregnancy before 20 weeks. Okay. And then they also would increase the chances of you having to go through a cesarean section. Because remember when we were talking about how exactly fibroids affect fertility, we mentioned that the uterine can have a change in size. Remember, if the fibroid grows into the cavity, that means there's obviously gonna be a change in the size, right? So it can happen that as the baby develops and when it's time for birth, the positioning of the baby can change because of these fibroids. So the baby can become breech. And if a baby is breech, then cesarean section is usually like the next course of action. And then another instance where a cesarean section can be considered is when in rare cases where the fibroid would be blocking the birth canal, blocking the cervix, right? It's a very rare instance. Most of the time, in most cases, the fibroid, if even as large as it can, even when it's large, it can move out of the way for the baby, right? And that is in most cases, but there are rare cases where it could be blocking and C-section would have to be done. Yeah, so the other concern with fibroids in pregnancy is that women with large fibroids would be at a high risk of losing more blood compared to another lady that wouldn't be having fibroids, right? So there's an increased chance that she would lose more blood, and that could be a complication that would require interventions, other medical interventions. So, just to wrap it up, it's important for you to know that having fibroids does not automatically mean that you are going to have a complicated pregnancy or you're not going to be able to conceive. There are a lot of women that have gone on to have healthy pregnancies. They've conceived, they've given birth, everything is fine for them. If you are trying to conceive, or if you know that you have fibroids and you're pregnant, it's important for you to work very, very closely with your doctor, with the healthcare provider. Okay? If you found this video helpful, if you found it entertaining, educative, if you left this video with having some new knowledge of sorts, please leave a comment if you can, or leave a like, and please subscribe to my channel. Thank you so much for watching till the end. Look out for the next video that will still be on fibroids. We're still going. So thank you once again. Until next time, bye.